Hello, and welcome. Today we're diving into a common yet often overlooked condition affecting the digestive system, gallbladder sludge. We'll explore what it is, why it forms, how it's diagnosed, and what can be done about it. Let's get started! So, what causes gallbladder sludge? It's essentially a buildup of solid materials in your gallbladder. This material is primarily composed of cholesterol crystals, calcium salts, and bilirubin granules. Several factors can contribute to its formation. These include prolonged fasting, rapid weight loss, total parenteral nutrition, where nutrients are delivered intravenously, and certain medications. Pregnancy can also increase the risk, as can conditions that affect gallbladder emptying. Now, let's delve into the pathophysiology. The gallbladder's primary function is to store and concentrate bile, a fluid produced by the liver that aids in the digestion of fats. When bile remains stagnant in the gallbladder for an extended period, the solid components within it can begin to clump together. This process leads to the formation of sludge. Over time, if left unaddressed, this sludge can potentially thicken and harden, potentially leading to gallstone formation or obstructing the bile ducts. Epidemiologically speaking, gallbladder sludge is a relatively common finding, particularly in individuals with specific risk factors. Its prevalence is higher in patients undergoing prolonged fasting, such as those in intensive care units. It's also frequently observed in individuals experiencing rapid weight loss, for example, after bariatric surgery. Studies suggest that a significant percentage of pregnant women may also develop gallbladder sludge during gestation. What are the signs and symptoms? In many cases, gallbladder sludge may be asymptomatic, meaning individuals don't experience any noticeable symptoms. However, when symptoms do occur, they can mimic those of gallstones. These may include right upper quadrant abdominal pain, often described as a dull ache or sharp cramping. Nausea, vomiting, and indigestion are also possible. Some individuals may experience pain radiating to the back or right shoulder. How is gallbladder sludge diagnosed? The primary diagnostic tool is an abdominal ultrasound. This non-invasive imaging technique allows visualization of the gallbladder and its contents. The presence of echogenic material that layers in the dependent portion of the gallbladder, without acoustic shadowing like gallstones, is indicative of sludge. In some cases, an endoscopic ultrasound, EUS, may be used to obtain more detailed images. While there aren't distinct classifications or types of gallbladder sludge per se, it's important to consider the underlying cause. The presence of sludge can be categorized based on its severity or its association with other conditions, such as biliary dyskinesia, but this mostly informs treatment planning rather than defining distinct subtypes of the sludge itself. Treatment and management depend largely on the presence and severity of symptoms. If asymptomatic, often no immediate treatment is required. If symptoms are present, the initial approach focuses on addressing the underlying cause. For example, if prolonged fasting is a factor, initiating enteral or oral feeding may resolve the issue. Ursodeoxycholic acid, a medication that helps dissolve cholesterol, may be prescribed in some cases. In severe or recurrent cases, or if complications arise, surgical removal of the gallbladder, known as a cholecystectomy, may be considered. Can gallbladder sludge be prevented? While not always preventable, minimizing risk factors can help. Maintaining a healthy weight, avoiding rapid weight loss, and ensuring adequate hydration are important steps. For individuals undergoing total parenteral nutrition, careful monitoring and management are crucial. If you have a family history of gallbladder issues, discuss preventative strategies with your doctor. The prognosis for gallbladder sludge is generally good, especially when diagnosed and managed appropriately. In many cases, the sludge resolves on its own once the underlying cause is addressed. Research continues to explore the long-term implications of gallbladder sludge and the optimal management strategies. Studies are investigating the role of diet and lifestyle modifications in preventing recurrence. Keep in mind that the information we've covered today is for educational purposes only, and it's essential to consult with a healthcare professional for personalized medical advice.